As we start to learn more about the new COVID Omicron variant, local health officials say they're ready for whatever happens. This is KOIM News at 6. KOIM's Chris Warner has more on what they've learned and how they're using it to move forward.
There's not a lot available yet on the new Omicron variant, like how contagious it could be or whether or not the symptoms will be more severe. Despite the unknowns, what's been learned from the past is helping local hospitals prepare for what's next.
We've had multiple surges over the past 2 years, and each time we've reached a new high water mark, we've had to advance our plan and increase service lines. And so, we have the ability to flex to 3 units if we need to and run them full time. And we've done that in the past, and we'd rather not do it again. But we still have those resources and ability.
Dr. Rob McNabb is Freeman's Director of COVID Services. He spent time ensuring the hospital is ready to treat the next potential wave of COVID patients.
Our supply lines have been built up to be much more robust as far as protective items for patient care.
While current inpatient COVID numbers at the hospital are low, Dr. McNabb says they won't be letting their guard down now or in the future.
I feel like we have incredibly increased our reserve to be able to flex as we need to deal with any further surges.
We reached out to Mercy Hospital in Joplin as well, who told us in a statement that, quote, "At this point, we are well equipped to care for everyone who needs us, whether for COVID-19 or any other illness." As for Freeman, they're taking what they've learned and applying it to the future of the hospital.
We're about to go into a growth phase here at Freeman, looking at big structural changes, and part of that design is wrapped around needing to have reverse isolation and a respiratory isolation ward. I don't see where we will not need those resources into the future.
In Joplin, Chris Warner, KOAM News.
Dr. McNabb says he wants to continue to urge everyone who can get vaccinated to do so. And he says if you're eligible for a booster, you should get it as soon as possible to stay ahead of the virus.